Hi, my name is Melina Kibbe from Northwestern University. I was really happy to moderate a session that was called The Next Best Thing in Cardiovascular Sciences. This was really a lightning round session where representatives of each one of the American Heart Association councils presented on what the next best thing is in their topic area. Here's a sample of some of the exciting talks that we heard.
I'm Darwin Labarth, Professor of Preventive Medicine at Northwestern University Feinberg School of Medicine in the Department of Preventive Medicine. I'm also here as a member of the Leadership Committee of the AHA Scientific Council on Epidemiology and Prevention. The message in this short talk is that promoting and preserving ideal cardiovascular health from childhood through adulthood is the next best thing. What is cardiovascular health? It was defined by the American Heart Association in 2010 as part of the impact goal for the coming decade. It comprises 7 metrics: current smoking, physical activity, healthy diet score, body mass index or BMI, blood cholesterol, blood pressure, fasting plasma glucose. By these metrics, we define ideal, intermediate, and poor cardiovascular health separately for children, persons 20 and under, and adults over age 20. Why is cardiovascular health important? Data from the Framingham study illustrate a body of evidence accumulated over many years to show that being at low risk of cardiovascular disease at age 50 predicts longer, healthier life, free of cardiovascular events, and with reduced healthcare costs. Ideal cardiovascular health is modeled after the concept of low cardiovascular risk. Being at low cardiovascular risk at age 50 is a very, very good thing. How do we know in the United States what proportion of the population do have ideal cardiovascular health? These metrics are followed through the National Health and Nutrition Examination Survey, or NHANES, a new cycle of the U.S. population sampled every 2 years. Data from the 2009-10 surveys were reported by AHA Statistics Committee update in 2014. What's the picture that they show? The picture is a prevalence of about 50%, slightly less, of ideal cardiovascular health in childhood at age 12 to 19 years. At age 50, it has declined to 10%. We are losing cardiovascular health from childhood to adulthood at a time when AHA is committed to improving it for all Americans by 20% by 2020. What's wrong with this picture? What's wrong with the picture is that it is not the alternative picture. Imagine the decline, 47% to 10%, and the alternative, beginning at 100% and remaining there through the life course. That is the desired picture. Aiming too high, perhaps? No. The 2020 goal is for all Americans to improve their cardiovascular health. No one should be left behind. So how do we produce this change? For one, we stop the loss of cardiovascular health from childhood. Second, we must increase the level of ideal cardiovascular health at birth. And so we both promote and preserve ideal cardiovascular health at and from the beginning. There is, of course, another approach. Imagine rolling that ball up the slope to reduce cardiovascular burden from poor to intermediate to ideal cardiovascular health. This is a time-honored but costly approach. It is not sufficient to bring about an ideal cardiovascular health through the life course, from birth throughout life. And so, while we can and must continue to reduce the burden of cardiovascular behaviors and factors by improving those that have already slipped, the major investment and the next best thing is a commitment and investment to promote and preserve ideal cardiovascular health from the beginning. Thanks very much.